be recording this meeting for training purposes. My name is Annette Cole, and I'm the Public Health Program Manager for North Country Health Consortium. We are presenting tonight the points of dispensing training to provide you with information about coordination, planning, and response during public health emergencies that require countermeasures given to a group of people who are at risk of exposure to disease. And the goal of a closed pod is to provide medications or vaccinations to the public or employees of an organization in a coordinated, orderly, and efficient manner to help slow or stop the spread of a disease within a community. An open pod is a public dispensing site that provides medications to the general public, and the closed pod is a non-medical dispensing site that provides medication to a targeted dispensing population, which is usually the employees and their families of an organization. Operating a closed pod is a tremendous support to the workforce, especially when it comes to healthcare and first responders. The closed pod ultimately helps with continuity of operations by helping to keep the staff healthy and make them more resilient during and after an emergency, enabling them to return to their normal duties within their organization more quickly. The more closed pods that exist in a region, the more efficient dispensing efforts become in overall producing a better public health emergency response. So we like the closed pods a lot. In current times that we're in with the pandemic and increasing the number of closed pods in the region is a real goal for us. We like to exercise both open and closed pods whenever we can. Next month, we will be doing just that with the community-based flu vaccination clinic by partnering with the towns of Littleton, Lancaster, and the town of Haverhill for 3 open pod flu clinics and 1 closed pod. So all of the work that happens within the open pods and the closed pods supports general public health and the well-being of our communities. So we thank you very much for coming and learning more about this tonight. And I'm going to turn it over to our trainer, Jim Richardson.
Good evening, everyone. Thanks for coming out with us tonight by Zoom and learning all things closed pod related. Like Annette said, this is really a timely topic for us to be doing this training. The state of New Hampshire, as well as the federal government, is really planning for COVID vaccinations here coming up this winter. I can tell you that every state in the United States has to have their plans to the CDC by November 1st. All of the calls that we're on weekly with the state public health department and the CDC assignee, they're really asking us to develop more closed points of dispensing in New Hampshire in general. And specifically for the North Country, it's hugely important because we have very limited resources up here. In addition to, we have some challenging weather that you guys know about really well. And we have some limited infrastructure, limited roadways and things like that. So it's super exciting that we have an influenza program coming on in October. And for the first time ever, we're going to be doing this in a different type of an environment. Instead of being in the schools, we're going to be in different facilities within the 3 communities to practice our pod plans and to provide influenza vaccine to children and adults. So this is really a good time to practice that. Practice makes perfect, as you know, and we really hope that all of you can help us out as we develop these influenza clinics and work with us to provide that. So what we're going to talk about a little bit tonight is some of what makes up a closed pod, some information around what a closed pod is, who are really good closed pod partners. And one thing we've been able to do this fall is be able to look outside of the box at the recommendation of one of our local fire chiefs. And something that we had never thought about before was having a municipality itself become a closed point and dispensing site. And we'll talk about some of the requirements for that. Some of these are CDC requirements and state of New Hampshire requirements too, but all of the communities that we've been talking to in the past month, they meet those requirements. So we'll go over some of those things. We'll talk about the importance of having a planning team. We'll talk about the importance of having MRC volunteers to be able to help in this effort as agencies become closed pods, to provide medical countermeasures, and in our case, really, right, everything is kind of COVID-19 planning right now. But as that operationalizes over the winter and into next spring, it's really going to be incumbent on all of us to work together. And it truly does take a village to do this. And this effort, we've been told by the folks at the state and the CDC, is going to take at least 6 months to do. So this is not a short-term event. It's going to take a lot of planning, a lot of work to do. But the ultimate goal is to provide herd immunity, right? So we can stop wearing our face masks and going out in public without being overly nervous. Okay, so these are just kind of some of the objectives. There's different specific threat scenarios that we're going to talk about tonight, some planning assumptions that we've been planning for over the past 15 years. Understanding the concept of what a closed pod is in general, and then we'll get a little bit into the weeds, hopefully not too much, but a little bit. And then understanding how the organizations that are on the training tonight can help out and to understand actually what the process is. You can become a closed pod. There's a whole lot of steps to become one and to really have a good understanding of that. We'll talk about that process and how we do it up here in the North Country. So I would like to say that if you guys have any questions at all, please feel free to stop me, and ask a question if there's something that doesn't quite sit well with you or that you don't understand. If you'd like to also just comment on something, please, I'd like this to be as interactive as possible. We'll give you a short break after about an hour, just so you guys can get a glass of water or your favorite adult beverage if you're so inclined. I'll be having mine later tonight, but we'll give you a few minutes here to be able to take a little breather if you'd like. Okay. Okay, so understanding the different roles. So in anything that we do, any of the planning that we do that comes from the federal government and state government as well, really everybody has a role in this, right? So the roles start at the federal level. They get pushed out to the state level. The state pushes it out to the local level, and in our case, really the regional level, because we are a public health network, which means that we're an emergency preparedness region up here in the North Country. And then the role of the private sector, industry, and non-governmental organizations like nonprofits, federally qualified health centers, and things like that. Okay, so at the federal level, this is the agency that really is responsible for all of the stockpiling of medical countermeasures that you guys have heard about over the last 6 months, right? A lot of banter going back and forth. Why didn't we have enough PPE? Why were our masks out of date and things like that? This agency here, it's called ASPR for short. Their mission is to stockpile medications for the entire country and PPE, personal protective equipment. So they also provide funding at the state level and through the federal government to help us to do planning for all of these different types of pods that we work on. The alternate care sites that you guys have heard about at hospitals, so they provide a lot of funding for that. And they've been doing that since 9/11. So we're really in a pretty good place with our plans. It's just that initially, all of our planning was for a different threat scenario, and now it's changed. Okay, one thing that's really important to know is, as it relates specifically to vaccine, because everything is COVID related, right? The CDC uses 5 tiers to provide vaccinations, right? So as their planning has started over the past 4 or 5 months, they really look at tiers or groups of people that they want to provide vaccinations to for. So it's not just necessarily COVID, it's any type of vaccine. So if you look on the very left side, it's the occupational groups as well as high-risk populations. So within that occupational group is people like us, right? We're essential health workers. That includes MRC volunteers. You guys are considered essential health workers as well. EMS, law enforcement, public safety in general. critical healthcare and infrastructure, so our long-term care facilities, our hospitals, and things like that. And then the high-risk pops, which are the pregnant women and infants and toddlers. And they figure that population, or that targeted group, is equal to about 26 million people. So as the first vaccines become available, no matter if it's a COVID vaccine, if you guys remember back in the H1N1 days, it was H1N1 vaccine. They target that to a select group of people. And the reason they pick essential healthcare workers is because we have to help people get the vaccines, right? So if we're sick, if you're sick, we can't help anybody. If the public safety officials are sick, they can't help anybody. So that's why they really target those groups first with the first vaccinations that become available. And then they look at who is really at risk the most, and that's the pregnant woman, and then typically infants and toddlers. The next group, as you go to the right, there's a few less of those. There's about 16 million of those people nationwide. Those are the essential military folks, other healthcare personnel. So it may not be the frontline healthcare workers, but it could be other people that do administrative type work and things like that. Critical government, operational, and regulatory personnel. So, and then other high-risk populations, which are, heads of household contacts with infants less than 6 months old, and then high-risk children. And then it just kind of goes over to the right, and I don't have to read every one of these for you all, but those numbers go up, 68 million, 79 million, and then the very last people to get the dose. And this is probably the way it's going to play out, is 132 million people, and those are people that are at the lowest risk of having a really bad, health condition because of becoming infected. So these are priorities that the CDC uses all the time, no matter what the vaccine is. And this is what we were told, probably this is the same type of scenario they're going to look at for COVID. Okay, just to kind of continue on a little bit with the federal role. The SNS, the Strategic National Stockpile, their role is to have local supplies available for the municipalities, for state governments, to provide medical countermeasures, provide PPE. So right now, because all of this has been depleted at the federal level, we're having a really hard time getting it. I did a PPE request the other day for one of our long-term care facilities up here that we're having a hard time getting gloves. And when I called the state, they said, we're running out again. So I had no idea that that was the case, but that they're having a shortage again because a lot of the supplies that are coming in now, they're coming in from Vietnam instead of from China. And they're having a hard time getting it because guess what? Vietnam's having an outbreak now. So because it's their country, those folks get it first. So all of our stuff is on back order. So they, the long-term care facility that reached out, they were able to get their supplies, but I was told, a lot of the supply requests now are being halved. So if you ask for 100 cases of something, you're probably going to get 50 until they get replenished. So the Strategic National Stockpile really is trying to replenish all of the personal protective equipment they've given out over the last 6 months. And it's a tall order. So hopefully it'll get all squared away. The supply chain will be in a really good place before we have to do COVID vaccinations. Does all that make sense? That's kind of like a higher level view from the federal response level. And I know people have heard so much about it in the news, on social media, who's responsible and things like that. So I have no knowledge on that besides what I know these agencies do. At the state role, the Department of Health and Human Services, as you guys know, is really the lead response agency for public health events. And within that agency, it's huge, is a small group of folks called the Emergency Services Unit. And they really lead in the development of both our open and closed pod dispensing partnerships in the state, and they have done so for about 10 years now. They work really closely with the 13 public health regions in the state, and they have a dedicated staff member called the Strategic National Stockpile Coordinator, and they're really responsible for helping us develop both our open pods, as Annette talked about at the beginning, as well as our closed pods plans and providing subject matter expertise and things like that. And they also have a logistics unit, so as some of our agencies and our entities are looking for PPE, that request comes to us, and then we send that request down to the state at this unit here, and they're the ones that we're in contact with, and they set up the distribution of that personal protective equipment to the requesting agency. So they've done a really good job with that. And they have a really huge warehouse down in Concord. They have the National Guard actually sets up the delivery and the delivery sites. And in the North Country, it's at Twin Mountain. And they'll go there, set up a staging area, and then the agencies that request the personal protective equipment will go to Twin Mountain and pick it up. Okay, so if you didn't know this, this is I just put this in there just so to be helpful a little bit understanding the state law. So in New Hampshire, it's the Department of Health and Human Services Commissioner who is responsible for declaring a public health event or a public health emergency. So it's not the governor, it's the Commissioner of Health and Human Services. So they work closely with the governor's office and the New Hampshire Homeland Security and Emergency Management Agency to work under these declarations of emergency, but for a public health event, it's the commissioner that makes that declaration. So what's important about that is that during H1N1, we didn't have a state of emergency declared during H1N1. We had a public health emergency declared by the commissioner's office. This time around, it was really the governor that declared a state of emergency, and that allows a lot of federal funds to flow into the state from the federal government, from a variety of different agencies, from the CDC to federal homeland, to be able to help pay for all of the efforts that we've been undertaking since March, I guess. Okay, within Health and Human Services, there's a division underneath them, which is the Division of Public Health Services, which has the Public Health Lab, the Bureau of Infectious Disease Control, and the Bureau of Public Health Systems, which in part are responsible for overseeing the public health preparedness regions. So what that means for us really is that we get our marching orders as well as a small amount of funding to do planning around open pods, closed pods, and other things up in the region. And they tell us what the priorities are for the state for a particular year. And then we have one person who's a full-time employee here at the consortium that helps provide expertise and technical assistance to the agencies that we work within. Okay, now the fun stuff. Really, this is our regional role. So how does this affect us? Where are we at with our points of dispensing, and what does that look like? So in the North Country, we have 6 open points of dispensing located geographically throughout the North Country, right? And their primary mission when they're activated is that they're going to provide medical countermeasures in either one or two different forms. It's either going to be pill form, an antibiotic, or it's going to be a vaccine. So the open pods in the North Country are at the Berlin High School, the Colebrook Elementary School, the Lancaster Elementary School, Littleton High School for now, Bethlehem and Profile Middle High School in Bethlehem, and then the Haverhill Elementary School. And the reason I said for now when it comes to Littleton is because when we pick out these locations, you guys notice they're all schools, right? So they don't have to be schools, but the SAUs have been super supportive over the past 15 years by allowing us to use schools because they have really big, wide open spaces. They have really good parking, and they have infrastructure to support these big, huge open pods that we have. Sometimes the school isn't really the best fit. So do we have to have it at a school? No, we don't. We can partner with another agency that may be a better fit, that may have better parking. And as you all know now, with the schools in the state that they're in with COVID-19, some are open, some are not open, some are open half of the time. It's super challenging to try to figure out what the best partner is when it comes to open pods. Closed pods are pretty easy, but open pods are a lot tougher. So knowing that we have, you know, a disease right now and that people don't really know a whole lot about, they don't know long-term effects about it. Some of the schools may not be as inclined to let us inside the school. So we either have to change our model of how we deliver countermeasures to you all and to the citizens in the North Country, or we have to try to find a different facility that is okay with us coming in to provide medical countermeasures to the citizens. So we're currently having conversations. I actually met with the Littleton Fire Chief yesterday and his Deputy Emergency Manager to talk about Littleton High School. And it was agreed that that probably wasn't the best fit right now to maintain their open pod status. So we're going to be looking at some other facilities in the town of Littleton, because all of these pod sites are attached to other communities. So it's not just the city of Berlin citizens that go to Berlin High School. It's Berlin, it's, don't let me get this wrong, Annette, Sherborne. Is that it?
Shelburne?
Yeah, I knew I was going to get it wrong. Shelburne, thank you. Gorham, Errol. So other communities, these are regional points of dispensing sites. So it really affects other communities, not just the one where these pods live. So it takes a lot of work to develop these plans. They're pretty robust plans. They take some time. So really, time is not our friend right now. So we're really working diligently to try to locate another place in Littleton for Littleton folks. Any questions on the open pods? I guess one of the other, oh, go ahead. Okay, if nobody had a question, I guess just one of the other things I wanted to say was that we had conversations back this summer about the challenges with staffing these pods. And I can tell you that each one of these for one 12-hour period takes about 42 people. So if you multiply that times 6, that's a whole lot of people. So that's why Annette has been really diligent working to recruit more Medical Reserve Corps volunteers of all backgrounds, because it really does take a village and to try to build as much capacity as we can within the region. So that if the state says, hey, we got to open a pod to provide COVID vaccine, we can confidently do it in a timely manner. Does that make sense?
You're looking at Littleton, but what about the other sides? If they're all schools, aren't they all going to have the same issue?
Did you hear that, Jim?
I did. I think it was Susan.
It was Susan, yep.
I don't know what she said though.
Susan, your audio, yeah, was a little bit challenged. Would you mind repeating what you asked?
It is. You mentioned Littleton, but the other places are all schools as well.
You can type in the chat box if she has a
You can
question.
type it in the chat and then I can let you know, Jim, what she said.
Okay. Okay, so one of the cool things that we did this spring, late spring, as part of our local and regional responses, within our plans, our command and control component of our plans, we developed this unified command staff, which really is made up of the multi-agency coordination entity, which really is a much larger group. So we kind of shrunk down that command and control component into a group of 6 folks. And they're all decision makers. So they're all emergency management directors from your communities. The communities are listed there, as well as the public health director from the North Country Health Consortium. So the key here is that they're decision makers. So when we needed to make some decisions about allocating personal protective equipment when we only had a very few, they were the ones that said yes, no, or, you know, this person needs to get it more so than this person. So, so that's kind of our local response. And the reason that I put this up here is because as we get into the closed pods, you're going to see that these folks, a lot of the communication that flows from the closed pods goes to these folks, these 6 people here, as it comes to when we get the vaccine into the North Country, it's going to come to us. We're going to have the unified command staff is going to be in charge of disseminating it to the closed pods and things like that. So I just wanted to let you know that these are the folks that provide that command and control component for us. And we have other people within this unified command staff. We have, you know, the public information officer, Annette is on it as the volunteer management director and things like that. So, but as far as the very top of that food chain, it's these 5 EMDs and the public health director.
So Jim?
Yep.
Question was, what about the other towns and schools, not just Littleton?
So like, for example, maybe Lisbon. So Lisbon, the Lisbon folks go to Littleton. So that's a great question. If Lisbon, let's say we reached out to Lisbon and they were amenable and they had a really good location when we did a site visit, then yeah, Lisbon would be a fine spot. Yep. So there's no reason not to do that.
And she's asking Berlin, Lancaster, etc., which I think we had Berlin, right? You have Berlin,
Yes.
Lancaster. You did have them.
Yep.
Okay, there we go. There's the list.
Yeah, so far, really the only one, excuse me, that we looked at was Littleton because that was kind of the priority right now. And, you know, I don't have a lot of visibility from the SAUs that are in different parts of the North Country, but so far the only one that we really identified was Littleton. So, you know, it can be any of the schools up there for sure. It doesn't, for example, you know, it doesn't have to be the Lancaster Elementary School. It can be a different school up there. So we have a list of all of the towns that go to each one of these pod sites that have been in existence for about 15 years. So if another community, let's say in Bethlehem, it used to be in Franconia, for example. And then before my time, it was moved from the Franconia Elementary School over to Bethlehem. And I'm not sure why that's where it is now. So, so yeah, I mean, we're really willing to look at any other schools that, you know, might be willing to allow us to come in, especially for COVID. So thanks for the question, Susan. Okay, so we started about a year ago developing more closed pods in the North Country. We said we were going to do 2. We told the state and they said, whoa, we'd be really excited if you got 2. So this is how many we got. So like we're a little bit of overachievers up here, right? We like to do things. So we ended up getting a whole lot of them and it was really super exciting to be part of that initiative. And there's a lot of steps to these folks. And I'll tell you that the long-term care facilities really stood tall. We worked really closely with them, developing their plans and, you know, different documentation that are required. A lot of them participated in a functional exercise that we did last year in Berlin. And we need more. That's the bottom line. We need more. So the very bottom one is really exciting because thanks to that fire chief again for thinking outside the box, what the North Country does really well too. For the first time ever, we're partnering with a community. And I don't want this to be the last time, folks, okay? So if there's any municipal officials on this training tonight, we're coming for you. The town of Lancaster EMS division stood tall yesterday. I met with them and they are going to get their paramedics and advanced EMTs certified to provide vaccinations. They're going to do an influenza clinic on October, what's the date, Annette? October 10? What?
October 17th.
17th?
Mm-hmm.
Man, I'm like 0 for 2 so far. Thank you. That's why Annette runs the show. All I do is I'm just like a talking head. And so they're going to actually participate at this vaccination clinic for us, but even more exciting is that they have agreed to partner with us to provide COVID vaccine or any kind of vaccine to all of the employees in Lancaster and their family members. So I've done a lot of work down south in South Carolina doing this at a county level, and it's super fun. And they do it down there because they recognize, again, if the municipality can keep their staff safe and vaccinated, then the municipality can run and they don't have to worry about, sick time or sick leave as much if they didn't do this. So kudos to the town of Lancaster. They really stood tall. They're the very first one in the entire region to do this. And then I went over to Littleton and, I love the fire service, being a former fire chief. So, they have a little competition going on. So Littleton Fire said, we can do that too. So now we're talking to Littleton, and they're going to be a closed pod probably in Littleton too. The fire chief and the deputy EMD, who's a paramedic, said, yeah, man, we want to do this too. So this is awesome. It's thinking outside of the box. I don't even know, honestly, if it's been done in another part of the state at all, ever. So if it hasn't, you guys are leading the way. You take a lot of credit, and kudos to everybody for standing tall. And this is just the beginning, as far as I'm concerned.
So Jim,
Yes.
had a little bit more of a question about, I think, the open pods that she was asking about.
Okay.
To use the schools for the COVID vaccinations. Should we look at other facilities for open pods?
Yes. Yeah, so that's a great question, Susan. So I can tell you that I was given the name of a facility in Littleton yesterday. What did I tell you it was, April? The Elks. Nice. Knights of Columbus, because they have a big area that can hold 300 people and they have great parking. So we will partner with anybody that will talk to us. So if you know of an agency, if you know of an industry or some place that can hold a few hundred people, like a large open space, think of an auditorium or something like that, please email Annette and tell her, and we're happy to talk to anybody. So that's a great point, and thank you for the question.
And she added the Lancaster Fair site. I feel like she is reading our mind, Jim, because
Yeah. Go ahead, Annette. Go ahead.
So Susan, we were looking at where we could host, what would be a good location for us to host one of these flu clinics that we were trying to figure that out. And, what's a good location that's open and big enough to host for a lot of people. And that was one of the sites that we really considered. And that's exactly, what we need is something like that. We need to look at places like that because it's true. Schools aren't always the best option in terms of, it's some of the places like Berlin is a good example, but something like the Berlin Middle School. It's an older school in the middle of the city and there's no parking around it. There's not a lot of good traffic flow. So schools aren't always the best option. So yeah, something big and open like that is ideal. And no, please don't apologize for asking questions. It's great that you do.
Yeah, definitely. Thank you so much. And anybody else, if you guys have any comments or give us any thoughts, we certainly don't have all the answers. And we try really hard to partner with as many people as we can. And the whole goal is to make sure everybody's as safe as possible and can get the vaccine when it comes out, if they want it. Oh, no. Stand by. I'm having a technical challenge. April, the public health director that I mentioned as the decision maker, is here to help me.
So I'm not sure. It should.
I feel like we need to have like one of those signs that says, please stand by.
Was that where you were?
Yeah, that's where I was, thanks. She fixed it. Okay, so we're gonna talk a little bit, just for a couple minutes about the planning scenarios. So back in the day, 2004, when we started planning for this, when the CDC gave us a bunch of money, it was always around aerosolized anthrax, right? Because of the anthrax attacks after 9/11. So they said, this may happen again, so we wanted to plan. So all of those plans that I talk about really were around aerosolized anthrax. So what we do for those is we give antibiotics, right? We don't do anything with vaccines. We never did. It was always Cipro and Doxy, and that's what we planned for. Starting about 3 years ago, maybe 4 years ago, and post-SARS, but right around the time Zika came about, they said, oh, there's going to be probably other things we need to plan for, like Zika, like SARS, and now COVID-19. So because we've been doing some initial planning around that, we're in a pretty good place as far as our planning for emerging infectious diseases, but we have a long way to go because it really has only been about 3 years. All of the exercises and the trainings that we've done over the years have really been around anthrax. So we need to do more of that. This just isn't the time to do it right now as far as the exercising go, because exercises take a lot of effort and a lot of time. And the best exercise we can have is a real world event. So Annette and her flu clinics came along and we said, hey, let's practice with the flu clinic. So that's what we're doing. So you guys are going to start seeing, I think, some information coming out. Annette's group has adult doses of flu vaccine available for the first time ever. And thanks to the CDC and the state. So we're going to be sending out information. It may have already gone out. I'm not really sure. To be able to pre-register for one of these 3 clinics that we're putting on, which is really a test of our planning assumptions. So you guys can go and get a free flu shot if you want and be part of the process. And then after you get a flu shot, after you wait 15 minutes, then we're going to put you to work and we're going to have you help us out. So don't be running off after 15 minutes. You can't go to Dunkin' Donuts or anything. You have to stay and help Annette because she has a bunch of positions to staff. So isn't that right, Annette?
Yes, thank you, Jim.
You're welcome. And if the plan doesn't work well, don't blame me. I just wrote it. Okay. So, so one thing that's important to know is the timeline for this whole dispensing thing. So for anthrax, we always had to plan to provide these medical countermeasures, Doxy and Cipro, to the entire region in 36 hours. But you say, but Jim, it says 48 hours. So they gave us 12 hours to set it all up. You know, nice that the feds are. They said, we'll give you 12 hours to get all of your pods ready to go. And then at the 13th hour, you have 36 hours to provide anthrax, antibiotics, Doxy and Cipro to your entire 56,000 people up here. So one of the good, so that's always what we've planned for. That's what we practiced for over in Berlin. We did that big functional exercise with the hospital and a bunch of the long-term care facilities, which was awesome last year. So the upside to this is that vaccines have no specific timeline. So when the COVID vaccine comes out, right, who knows when, December, January, February, nobody's going to tell us how fast we have to do this. So we have a little breathing room to put this together, to identify, you know, the closed pods that we already have, how they're going to get their vaccines, and then whether we're going to use our open pods, which do take an awful lot of effort, or we're going to do it in some other type of model. So I can tell you from being part of this response during H1N1, the state didn't tell us how to do it, which, you know, was a shock. So they just said, you go do it and provide as many doses as you can. So I did 41 clinics. I did them at ski areas. People skied down the mountain. We shot them in the arm. They skied, went back up to the top and kept skiing for the day, which was awesome. We did them in firehouses, libraries, police stations, anywhere we could. And it worked. So, and they said it doesn't matter how long it takes. So it actually took us 5 months to do that for H1N1. So I think maybe that's why we see these feds telling us a 6-month effort for this time. The other question is, how is it going to present? It may come frozen. It may be in a deep freeze state. It may have to be reconstituted. You may need 2 doses. So stand by on that one. They haven't figured it out yet. But as soon as they do, we'll let you know. So the upside is that we have some time as we do it. So it's not going to be this big, huge, mad rush and really stress out our limited staffing to be able to provide this. But believe me, you'll be hearing from Annette when we do. All right, so for our closed pods, these are our target groups. So this is who we look at to partner with, right? And I'll talk a little bit about that whole process and after the break, but we look at long-term care facilities, and I'm happy to report that in the North Country, we have all but one long-term care facility that's a closed pod. The hospitals. So because the state about a month ago said, leave the hospitals alone, basically, we have AVH over in Berlin, that's a closed pod, but we have not put any effort into having the other 4 hospitals in our region become closed pods, because the indication is that the state of New Hampshire, the DPHS folks, right, the division, will provide COVID vaccine directly to the hospital. So that takes us out of the loop. So that really, we have very limited manpower to do all of these plans and develop all these partnerships. So to spend our time and effort doing that really doesn't make a whole lot of sense. Industry, that's another target group. Large employers, that's another target group. So think of your Shaw's supermarkets. They'd be a great closed pod, and other large employers in the region. I know there's one in Lisbon, and I can never remember the name of it. Is it a wire company down there? Anybody can answer.
New England Wire, I think.
Is that what it is?
I think so.
Okay. I always wanted to go there last year and I never got around to it, but they look like they're a pretty big employer. County government. So like I said, down south, I've been working with a lot of county governments. Some of them are pretty good size, 1 million people or so. Some of them are small counties like the size of the North Country, 50, 60,000 people. So they're great. They can be great closed pod partners as well. Municipalities, we talked about Littleton and Lancaster. I'm hoping we don't stop there. And colleges. So colleges make a great closed pod partner, especially if they have a nursing program. So we have one in the North Country, right? It's called
White Mountains Community College.
Thank you. Boy, you're getting really good. So White Mountain Community College, they would be a great closed pod partner, right? Because they have nursing students and they have preceptors, right? Which are RNs that precept the nursing students. So that's just an example. So any college in New Hampshire would be a really good closed pod partner. One other example I didn't put on here. So I talked to the 45th Parallel yesterday, EMS up there in Colebrook, and they are interested in becoming a closed pod partner up there for the Colebrook, Pittsburgh area up there. So that would be a huge help to us. They have a bunch of paramedics and AEMTs. So more to come on that. So the 45th Parallel folks could partner with UCVH up there in Colebrook, and they could really take care of a lot of people up in the North Country, the high North Country, I guess. The Great North Woods, right? So that's all exciting stuff. Looking forward to it. And these guys have really stood tall and they're willing to have the conversations. And really that's half of it, right? Having the conversation and then trying to move it forward. And our ultimate goal, and I keep going back to this, is just to be able to provide vaccines to you guys, to all of the citizens. Okay, so in order to do this, there are some requirements. Some of them come from the federal government, the majority of them, right? The CDC. And then some of them really make sense. Not the ones that come from the federal government. They don't make sense typically, but some of the ones that we talk about really make sense. So the requirements are the facilities, local and county governments, and industry must have access to a medical provider in order to be able to provide medical dispensing of antibiotics or vaccine. So that's a federal government requirement, a CDC requirement, but again, it does make sense. If you don't have access to a medical provider, if you don't have access to staff that can actually give vaccines, then there's no sense in being a closed pod. So that's one. The next one is really the ability to provide cold chain management. So I just talked a few minutes ago about how this may present, this vaccine, right? And they're all over the board yet because nobody really has a viable vaccine. So every week we talk to the folks down in Concord and the CDC assignee, and they say it could come as a frozen vaccine, it could come as a deep frozen vaccine, it could come as a regular vaccine, right? 2 to 8 degrees centigrade, which we hope it is. But we don't know. So the facility has to be able to provide that cold chain management. So what that means is they have to have a refrigerator that can maintain 2 to 8 degrees centigrade. There never was a requirement to have a freezer, so hopefully that doesn't happen. But you know, if you don't have the ability to store the vaccine, you're not a good candidate to be a closed pod site. In New Hampshire, this is really cool. The vaccines can be provided by RNs, LPNs, we already know that, right? ARPNs, but they also can be provided by EMS agencies at the paramedic or the advanced EMT level. So paramedics and advanced EMTs, they used to call them EMTIs, intermediates. If they take an extra training and they're signed off by their service chief with the Bureau of EMS and their medical control physician at their hospital, they can provide vaccines. So guess what we've been doing for the past 2 weeks? Talking to all the paramedics and all the EMTs and saying, listen, here is the requirement from the Bureau of EMS in Concord. Here is the training. Here is the administrative packet. We met with Weeks Hospital the other day. They were super supportive of once the Lancaster EMS folks take the training of giving them their expanded protocol to be able to provide vaccine. So, so that is a huge win for us up here because we have limited resources, right? So without the Medical Reserve Corps nurses and paramedics and advanced EMTs, a lot of the other RNs up here and LPNs, they're already working. So their availability is going to be really limited to be able to help us out. So to have this extra workforce support is huge to us. And I can't thank them enough. At the end of this, I'm all going to buy them a beer, which might cost me a bunch of money, but it'll be worth it because these guys are really are standing tall, and the communities that are allowing to do them and the hospitals that we partner with. So again, my mantra, right? It takes a village. And this is just an example of that. And all of the efforts that people have been taking, like April, the public health director, and Annette, and people like that are working tirelessly to make sure we're in a good place. Okay, so if you choose to become a closed pod, why would you do that, right? So if you're a municipal official and you're taking this training, it really helps to achieve regional dispensing more rapidly because you all can provide the vaccine or the medical countermeasures, you know, God forbid if it is an anthrax attack, really quickly, because what we do, and I'll go over this a little bit more in depth after the break, is we just give people the doses and they do their own thing. So if you have 100 people in your municipality as employees and the CDC says multiply times 3, so you need 400 doses, we give you those 400 doses. You call Annette, say, hey, I need 400 doses of vaccine. She sends them to you or she tells you where to go get them. And then you guys are on your own, and you provide it at your own speed and within your own capacity. And then there's 400 less people that have to go to the open pod. And that's huge. I mean, all of the emergency managers that run these open pods in the region, they're really super interested in decreasing how many people are going to go to these pods, which is about 9,000 people per pod. So if we can help them out by taking 1,000 people per pod off of that, it really helps them with their limited resources to be able to operate that pod and provide the vaccinations or the medical countermeasures to their folks. So that's really what the biggest benefit at the community level is. For your agency or your organization, if you're a school official on this training tonight, for example, we've done a lot of closed pod agreements with schools because guess why? They all have school nurses. So if you take an SAU, let's take one, Annette. SAU what?
84.
Thank you. If you take SAU 84, and I have no idea where that is, and they have 5 schools, they got 5 school nurses. Guess what? They got 5 vaccinators. Awesome, right? So the school can provide vaccine to all of the school staff, and schools are some of the largest employers up here in the North Country, and their family members. So you take SAU 84, they might tell Annette, I need 1,000 doses to vaccinate all of my people. That's a wonderful thing in my world, because those 1,000 people don't have to go to an open pod, and you can provide really quick vaccines to all of your staff members and their families if you choose to do so. For the long-term care facilities, I think that's why they really stepped up tall last year. And they said, this makes perfect sense, Jim. We already provide medication to our residents. Why not do it for our staff and their family members too? So we did a bunch of exercises last year with a lot of the long-term care facilities in the North Country, and they all had fun. They took me out to dinner afterwards, which I really appreciated, because it's a lot of work to put these things on. So, so they're all good to go. And it helps to ensure the organization's continuity of operations. And again, it goes back to illness, right? If half of your staff is sick because they got the flu, let's just call it the regular flu, not COVID, and you could have helped decrease that number by being a closed pod, and you didn't. Now your organization is really going to struggle to operate, right? Think of a school where 50% of the teachers are sick, or an industry like the wire company in Lisbon, where 50% of the employees are out sick at a given time. They're not going to be able to operate. They're not going to be profitable. It's going to be a real struggle for them. So, so that's another reason why, being a closed pod is really beneficial. And then it really exhibits a commitment to the community, because it tells the community that you really want to provide these countermeasures and help out the open pods. So it's a great give back. Any questions on that? Okay. Okay, so how do they do this? How do agencies become closed pods? And Susan asked some great questions. So really, all you have to do is connect with the preparedness coordinator up here at the consortium. Complete a registration form. So that form is 2 pages long. It's user-friendly, I promise. I helped develop that form. It's really pretty quick. You can do it. Designate, and within that form, it really, we ask you for the name of your organization, designate some emergency points of contact. I think we asked for 3 of them. And then we have about a 7-page op plan that we will help you with to develop for providing the medical countermeasures, both as a, with both planning assumptions, I guess is the best way to put it. So either anthrax or vaccine. So the lift is not really heavy. The registration form, I don't know how long that took. We just did one for the Friendship House over in Bethlehem. I think it took, I don't know, maybe an hour to do. And then the operational plan is a little longer, to be honest. It'll take you probably, if you develop a planning team, it may take you 4 hours to come up with a really good plan. So, but we're here to help you along the way, in any way that we can, with some, technical expertise on putting these plans together and things like that. So, Okay, so some of our responsibilities, I talked a little bit about that. So at the Public Health Network, responsibilities and what their one full-time person, and remember now, this is only one person doing this full-time. They really provide the guidelines from the state and the federal government to ensure safe dispensing of medication. They'll assist you, we will assist you in the development of your closed pod plan that we just talked about. We also provide all the medication and accompanying information sheets if it's vaccine, right, the VISs and things like that. We help you with training and exercise support and provide tools, templates, and other ongoing technical assistance. So if you have a question about, clinic flow, no, Jim, this doesn't make sense. Can you talk a little bit more about clinic flow, or can you come to my facility and see what you think makes a good clinic flow? I've done a ton of site visits, and I'm happy to do that to the extent that I can. And the templates that we have, we're just about done putting together a toolkit, and it'll be electronic toolkit, and it will really help you step by step of the way to develop your plan. Okay, some of the responsibilities, if let's say we're going to stick with SAU 84, I think Annette said. So, if it's SAU 84, so you have to participate in the development of your own plan, which, only makes sense, right? You determine what's the best dispensing location. If it's at a school, they could do it in the school cafeteria. You might have a nurse's suite that you want to do it. It doesn't matter. There's really no wrong answer. Develop your own procedures for activation and recall processes. I worked a lot with a couple of the long-term care facilities up here last year on recall procedures for their nursing staff when this happens. So I thought that was really interesting to see how they were working through that, because everybody's minimally staffed, and with COVID, the way it hit, a lot of long-term care facilities took a really bad hit on staffing. Security planning, so I will tell you that when this vaccine comes about, you're not going to be able to just go up and pick it up without any kind of identification or anything like that. And all the planning that I've done up here in the North Country, there's always been a law enforcement official at the planning team meeting, which is super, because they think of things that we don't, because they always think about bad things, right? The receipt of the medication, so you guys have to, the facility has to agree to accept it. And there's a process for that. There's documentation, and then dispensing procedures. You develop how you're going to dispense it, by yourself. You also provide the staff to do that work, provide any kind of non-medical supplies. You agree to participate in training and exercise opportunities to the extent that you can. And then, again, this last bullet is really important, because the registration form that we have for you is not a legal document. So if your agency, if it's SAU 84, they get hit hard with staffing issues, and they just can't operate their closed pod, there's no legal requirement to do so. All they got to do is call the Unified Command Staff and say, we're up against it. We don't have the staff to support this. Can you either help us do it, or we just can't do it? So, so that, I think that's super important to understand, that there's no MOU with these closed pods. It's just a registration form. So it's really, to me, that's really an important thing. Okay, so let's just talk a little bit before we take a little break, is just about the process. So for the closed pods, they're definitely not as labor intensive as an open pod. I talked a little bit toward the beginning of the presentation that open pods take about 42 people to run one for 12 hours. So here in the closed pods, you really only have a few folks, right? So you have screeners that make sure that the people that are going to get a vaccine, whether it's an influenza vaccine or a medical countermeasure, other type of medical countermeasure, to make sure that they don't have any contraindications to getting that, right? So if you think about vaccines, are all made with eggs. So if you have a really severe egg allergy, for example, Guillain-Barré syndrome or something like that, screeners make sure that those people are screened in or out. The dispensers are the people that provide either, the Doxy and Cipro or a vaccine. They're going to be the ones doing that. And then you have educators that really provide the VISs, the vaccine adverse reporting and things like that. So it doesn't take as many people to run a closed pod as an open pod. And this slide here on the left, it just shows an agency, right? I think this looks to me like a rooftop bar I went to in Atlanta at a CDC conference. It was so beautiful up there, and they had the best margaritas, I can tell you. So that's just like an agency with a very small, it looks like a break room, right? And then on the right-hand side would be a school that has, you know, a bigger auditorium. Okay, a couple of different models that we talked about, and I think Annette talked about this at the very beginning, is we have a medical model, which is vaccinations, which causes us to use more medical people to give vaccinations, right? Because we have to have the screeners, we have to have vaccinators that are trained, and we also have to have people available so that after you get a vaccine, you have to wait 15 minutes. So that's a requirement. That's a state requirement. And when we do our clinics in October, at the very start of that clinic, at the very head of it, as you drive into it, you're going to see somebody there doing triage, and they'll do the COVID triage. They'll do, you know, the COVID screening, take your temperature and things like that. But there's also a questionnaire, and it says, you know, are you agree to wait the 15 minutes after you get a vaccine? So if you're not willing to wait, you're not going to get a vaccine. So there's no wiggle room there. And then those folks will, you know, have to go get one from their primary care, or they could go to CVS or something like that. But for these public ones where the CDC funds these vaccines, there's really no wiggle room. So in that medical model, it takes more medical staff. And the non-medical model, really, we don't need any. We're just going to be giving antibiotics, and we're going to be giving pill bottles. So you really don't need to have all of the medical staff to do that for oral agents. And that's why it says, you know, dispensing of oral agents. And then we use a rapid head of household dispensing. So one person could come in like a mom and say, I got 6 people in my family, and they'll give you 6 vials of doxycycline, and off you go. End of story, nothing else you have to do. You sign that, you know, you got them, and then off you go. So it's really quick to be able to do head of household dispensing. It is not quick to do vaccines, just because of the different steps that you have to take.
Jim, we have a question in the chat about the pod, and if there's a report that's required once the effort is complete. Do they have to list the names of the people that they vaccinated?
No, they don't. So they keep the people that they vaccinate, they keep that form with them. The agency keeps the form. We don't get that at all. What they do have to do, and that's a great question, is when they get, let's say they need 400 doses of vaccine. If they use 300 doses, they just have to give the other 100 doses back. And they can report if they'd like. There is no requirement, but if they want to report to the Unified Command Staff that they vaccinated all of their folks that they said they were going to, and that number was 450, that's all they have to do. So great question. Okay. So one thing about the medical model that I just wanted to talk about real briefly is that as we start, you know, thinking about COVID, for example, is with the state of emergency, the state of a public health event, the state is going to be providing a blanket protocol for dispensing this medication. So that's going to be really a time saver for us. It's going to be really helpful for the medical providers that they will have one set of protocols for providing this. And the reason we have to wait is because we have no idea what the presentation is going to be. But once it comes out, they will be providing us with all that documentation. Okay, I just want to talk a little bit for a minute about some of the liability protections. So a lot of different companies I've talked to over the past few years have said, hey, you know, what am I liable for? Are we going to get sued? So with the state of emergency declared for COVID and a public health event, you have federal protection under the Public Readiness and Emergency Preparedness Act. You have state and local legislation for public health emergencies. They have a thing, they actually changed the RSA, but it's still 508:17, which says that anybody assisting us is provided liability. They don't call it agent of the state anymore. What do they call that in that? What's that form?
I'm sorry, I still call it agent of state.
You do? I do too. Emergency, the boss said emergency worker. So there's a form
Oh, thanks.
that you all fill out as you're helping us do this, and it provides liability protection as well. And then RSA 21 P53 is the Public Health Powers and Duties Act. So you have protection at the federal and the local, the state level for anybody helping us with these open pods, with the clinics around COVID, not for like necessarily the flu clinic that we're going to be doing. That isn't an emergency, but in an emergency, there's all sorts of federal and state protection. Okay, so let's see how this works. So really, for agencies thinking about partnering with us to become a closed pod, it's really about protecting what means most to you and your organization, right? It's your staff, it's your employees, it's your family members, and it's your communities. It's a pretty light lift, and you know, I hope other agencies will, you know, follow the same model that Littleton and Lancaster are looking at, as well as all of our long-term care facilities and one of the hospitals up here, and you know, try to work through that. So I think it's time for, let me see if I got this right. Almost break time. All right, so we're gonna go over, when we come back from break for a few minutes, is we're gonna go over the MOU, the registration form, the pickup or receipt form, and the operational plan. And then I already talked about the closed pod toolkit is available right now, but you know, I'll talk about some of these different things. We don't have the MOU anymore, so I think that's a really good thing, but we do have the facility registration form and other forms as well. The pickup and receipt form we definitely have, and the operational plan too. So, so I'll kind of just go over those a little bit and talk about the planning team after we get done. Okay, look at that, huh?
So I'm just going to ask and everybody to enjoy your break, but when you come back, if you hadn't signed into the chat, just so that we can keep a record of who's attended the training, if you wouldn't mind signing your name and your organization into the chat. Thank you. Enjoy your break.
Annette?
Hi.
It's Kristen Roberts from Littleton High School. I just wanted you to know I'm here, but I'm not on a computer, so I don't think I can chat with you.
Okay, I'll sign you in the chat with your
Okay. Totally fine.
Okay. Thanks, Kristen.
You're welcome. Thank you. Are you still there? I have one more
Yeah.
thing for you. I was going to email you today.
Oh, good.
I won't have those forms ready for you by next Friday. I just got them today,
Yeah.
but I don't think they'll go out until next Thursday, Friday, and then the next crew won't get them until Monday, Tuesday, because I have to have somebody break them up and get them like to their home rooms.
Okay.
Just so you know, because it said you can pick them up on the 18th, and I was like, oh, I don't think I can pull that off.
Okay. So probably
Okay.
Tuesday of the next week.
If they bring them back, that would be wonderful. Otherwise, I can just kind of keep giving you a steady trickle as they come in.
Okay. All right. I'll be in touch. I'll email you to check in and see how
Perfect.
we get closer. Thank you.
Yep, you're welcome. Bye-bye.
Da 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 dum. Da 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 dum. Da 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 dum dum dum. We all back? Annette, how we doing?
I think we're all back, yes. Jim, something is peculiar about your screen. It looks like there's some writing.
Yeah, is there a Brad Shelty that's logged in for the training tonight?
Yes.
Okay, so,
Yeah, there is. I'm
Brad.
trying to get rid of it.
okay.
I'm not a techie either.
Hey, no worries. No worries. Oh, nice. You got it.
We're getting it.
Thanks for blaming me, Annette.
Well, Jim.
Wow.
You had help.
Okay. All right. So let's see. I hope everybody enjoyed their break. I got my water. So let's just talk a little bit about some of the different planning committee members and some of the different things as you guys are thinking about your closed pod. And I got to tell you, I'm really super excited that Annette had talked about the SAUs, and I think that's really, we need to talk to those folks here pretty soon about becoming closed pods, because that would be a perfect closed pod partner. So I know Annette talks to the superintendents a lot, right, Annette?
Yes, we try to. Yeah.
All right, so I'm going to give you a mission to talk to them about becoming closed pod partners, okay? Okay. All right, so the planning committee, so really this can be, any type of a facility as you're thinking about it is the leadership, right? Everything starts from the top down. So if leadership is really supportive of that, the director of nursing or nursing staff, when I work with the long-term care folks, the director of nursing always was on the planning committee, and then typically they had another nursing staff as well. Human resources, facility directors are really super important. They know their facilities more than anybody, so they know the capacity, whether they have generators, because as you think about cold chain management, what happens when the power goes out, or if the power goes out, right? We can't have vaccine warm up past 8 degrees centigrade. So that's an important one to think about as well. The emergency manager, they're always important. They have a lot of resources that they can bring, and we include those folks. MRC volunteers, they bring a lot of different skill sets as well. So within your community, if you have some MRC volunteers in the community or CERT volunteers too, think about having them on the planning committee. Public health, the EP coordinator, that's the FEP coordinator that is housed here at the consortium. They have a lot of subject matter expertise that can help you out too. And then because we talked about the security component of, especially COVID, having a law enforcement representative. I've done a lot of planning, both up here and down south, and law enforcement is super engaged, and I can tell you they're really, really nervous about what's going to happen when this stuff starts coming into the state. So having a law enforcement representative is important. I met with Chief Smith yesterday in Littleton when we were working on the DPW influenza drive-through pod for October 3rd, and he pointed out some things in the pod plan I had written for that wasn't going to work, so I was happy to change that today. So really, they're super important to engage too. So as you're looking at preparing, for your closed pod, you really want to think about your agency and what's the capacity that you have to do this. So if we think about, an SAU, for example, or if we think about the wire company, let's say you have 5 nurses and you have some administrative support staff in the principal's office, for example, or the superintendent's office, really thinking about the capacity that you have to be able to provide vaccinations, especially. I mean, pill dispensing is pretty easy, but when it comes to vaccinations, and then how many staff members do you have that you would want to provide countermeasures for? And I can tell you, folks, there's no wrong answer. And nobody is going to question you if you say, I need 100 doses or I need 1,000 doses. So the number is what the number is. So you all determine that based on, your initial planning meeting or, as you sit down to fill out the registration form, really what is the number that you're requiring. What the CDC says is really take your family member and multiply it by 3. So the example on the right just kind of shows that. You have 138 staff, multiply it by 4.5, which takes into account the 138 staff 2 times the 3, and then you get 621 doses. So that's really how that number is. Like I said, it's the number. So it's not a big problem. Nobody's going to tell you it's a wrong number. So that's how you determine that. So if you don't want to provide it to family members, if you want to provide it just to immediate family, that's really why you need the head of your organization, because they're going to make that decision. Some of the different entities that I work in, they say, well, what about aunts and uncles and cousins and nephews? To me, it doesn't matter. And it's never mattered. Whatever the agency wants to consider as a family member is totally up to them. Because the ultimate goal is to provide vaccinations and countermeasures and to not have these people show up at the open pod. So that is really the goal. Okay. When you're thinking about the dispensing location, some of the things you need to determine is, the communication equipment, your heating and cooling systems. Do you have a generator? If not, can you get a generator? So this is another great example of why you would want to have your emergency management director be part of your planning team, because they can get generators, to make sure that you guys don't lose power or don't lose your cold chain management capability. Handicapped entrances and exits and things like that. So all of those things is really things that you want to be thinking about as you're working through your planning. Okay, so what I did here is I really took some of the process that we use up here in northern New Hampshire, in the North Country region, is we operate with that command staff that I talked about at the beginning of the training. Those 5 people and the public health director here that are the decision makers, and they will actually notify the closed pods that are registered with us. So right now we have, 6 or 7. I hope we have a whole bunch more that New Hampshire has requested that we activate our open and closed pods in the regions. And New Hampshire will do that when vaccine becomes available and they're ready to start. So there will be a big, huge campaign, I guarantee you. There'll be a media campaign. They'll contact these emergency managers and they'll say, okay, the vaccine's in the state. It'll come in the middle of the night, like by the National Guard in armored cars, and just like they did for H1N1. And then they will provide distribution to the regions. So you guys will get a phone call that's going to be from somebody in that unified command staff saying, hey, we have the doses available. Activate your plan. When you're ready to take possession of the doses and the subsequent documentation, you let us know and we'll tell you where to come to get it. Okay, so that's how it works up here in the North Country. You will send a representative that you have designated on that registration form to the site where you're told to go to pick it up with a government issued ID. Some of the different facilities, long-term care facilities, are going to have a police escort with them or have an actual police cruiser come with them to get the vaccine. That's written into their plan. We know that ahead of time, which is awesome. And you're going to sign a form. You're going to get your vaccine. You're going to take it back to your facility, and you're going to do your vaccinations for whoever it is you determine you want to do them for. Okay. So you can see what happens here is that we provide you with everything, and then our responsibility pretty much is done because we have to get ready to open the open pod. And I'll take all of our resources to do that. So, so that's really important to have all of that worked out ahead of time. And we have all of the forms to do that. Okay, for the command and control component, we use the unified command system in New Hampshire. We have to. use the ICS system. So, and that's MRC folks were provided some trainings back in May,
Yes, in April and May.
April and May. And this is really important because it helps to organize your process, right? So it's really strongly recommended. We can't tell, you know, private entities or industry to use it, but we highly recommend it because it really, really works well. It's management by objective. Everybody has a role. Everybody knows what the role is. And you can see on the right-hand side of the slide, you know, we have different functions. So for example, on October 3, 10, and 17, and that is the pod manager. So she runs the clinics. That's the very top of that org chart that you see on the upper right. You have a security component, provides the supervision and security for the pod. The public information officer coordinates risk communication. So we have our public information officer and the unified command staff in the training tonight. Her name is Anna, and she does an amazing job with as a PIO. And she's one of the very few people that are still operating in that PIO role now, months and months after we activated the unified command staff. So we have different positions: operations section chief, and then what you guys will see that are going to help us out over the next few weeks is you're going to see a greeter. That's a role that's already been designated. I think Annette sent out some emails asking for some help for that. That's one of the roles, dispenser or vaccinator, obviously. The logistics section chief, that's going to be a role that we need filled out. And then we have some other ones as well. We need people to do triage. We need people to do the wait station and things like that. So if you build a hierarchical org chart, it just makes it flow really easy. And for people in public safety, they've been doing this for years and years and decades, and it just works well. So I'm thankful to the MRC members that have participated in that training, because none of this will be foreign to them. And as we start to work through these 3 clinics, which really are kind of like dry runs for us for the COVID vaccine, it'll be helpful, and they'll automatically be able to just step right in and be good to go. So thank you for all for you guys that are on the call from the MRC that participated in that training. So I just talk a little bit so I like to throw in like RSAs once in a while, because people go, why do we have to do this, Jim? So this is the reason. Okay, RSA 21P52, that's a state law that says we have to. And the federal government back in 2002 said, okay, state, you either make a state law that says that you're going to use the ICS system, or we're not going to give you any federal grant money. So every state in the country went and made a law, and we did too in 2005, actually, in New Hampshire. So it's a system we have to use. And it's a great system. I've been using it as a fire guy since the late 70s, and it really works well. So, so that's that. So at the end of the training, I put a couple links if you guys want to take it online, if you don't like listening to me all the time, because I love doing those trainings. Okay, so this just kind of, as you're working through your pod plans again, this is just kind of a centralized clinic flow. And as you can see, it's not super complicated. So as you're thinking about, you know, if you're a school district or a school system, or if you're a large employer, it's really not super complicated. You don't have to make it super complicated. And if you think about long-term care facilities and other healthcare entities, they already provide medication, and they already have a great system, you know, down pat. So this kind of shows, you know, in the first step, just like you'll see at Annette's clinics, you're going to have greeters. We made a greeter triage type person so that we could, because we have, you know, staffing concerns. So we actually kind of tag team those 2 positions. And then registration, everybody has to fill out a registration form. Hopefully, I did hear the Littleton High Schools on the training tonight. You know, they're sending those forms home with the children pretty soon, and we'll get them back so that we have an idea. Pre-registration is hugely important to help out. So having an idea how many people are going to want just the influenza vaccine is going to be really helpful. And And then you have, we're going to have a screening. So this doesn't show screeners, but we'll have a screener that will go through the final checkpoint. That has to be a medical person to make sure there's no contraindication. Then off to the vaccine, vaccinators they go, and then out. And then in New Hampshire, you are required to wait 15 minutes. So there's really, again, I hate to sound really hard about this, but there's no wiggle room on this one, guys. So if you know people that want to get an adult dose to help us out with our, this practice run, and they want a flu shot, because I can tell you I'm going to get one. If you say no, then, you're going, you won't be able to get one. So that's just, I hate to reiterate that again, but I did. So, okay. So, so when you deactivate your closed pod, so all you're doing basically is making a phone call or sending an email to the unified command staff and saying, hey, we did all our vaccinations, everything went well. Our closed pod is now closed, not operational. We demobilized it, and we have 25 doses. How would you like to get those doses back? So probably they'll ask somebody from your agency to deliver them to us, because I'm sure we're going to be running around like chickens with our heads cut off. So we may not have the staff to go get it. And then any other documentation. And for me, the documentation is just how many doses you ended up giving. So there is no other requirement that I'm aware of. There's no requirement that the state has put on us to collect any kind of documentation at all. Okay, I think one of the really big takeaways here for this one is really the second bullet. So you all know you're going to put your facility back, the way it was basically before you turned it into a little mini clinic. But we're going to do an after action report at the end of this, and it's really just like we did for our midterm AAR, which will be out the middle of this month, and we just sent out an RCC meeting, and that is going to be on, that's one of the agenda items, is we're going to show you all how we've done so far. We did finishing up an after action report, so you will be invited to do that and share your experience with us and with the larger group on how it went, how the process went, what you all felt went well, what didn't go well, so that we can make it better. So one of the good things about these forms we develop, we can modify them at any time. So we don't think we know it all. We're just kind of using best practices from around the country and hoping that it makes sense to you all as you're working to become a closed pod. But you'll all be invited to participate in that after action report too. So, okay. Okay, so this is just kind of something important to know, is that we only have a limited number of supplies, so your agency should really make sure as you're working through your pod plans that you have an appropriate number of tables and chairs and office supplies and things like that. If you have a big agency, you might want to use pod staff vests, which we have, which are really good for identifying who's who and who's the big dog. And they always wear the white vest, just to let you know. And then, garbage bags and things like that. Packing tape, caution tape, or fire line tape, to tape off an area if you don't want people to be in the hot zone, as it were. So things like that. And then just to let you all know that we have 2 supply trailers in the region, 2 logistics trailers. One's right now is dedicated to LRH in Littleton, and one is in Lancaster at Weeks Hospital. And we have a certain amount of personal protective equipment in there. Things like privacy screens, cots, blankets and pillows and things like that. Some administrative items as well, and a whole bunch of needles and things. So, if you needed, if it was really, really a vital thing that you had an acute need for something, you could always ask the Unified Command staff to provide anything that we may have. And then if we don't have it, then we can work with you to make sure we do a request to the state. We have that capacity to do that too. Okay, so really the next steps is, for the agencies that are on the call, if you're not a closed pod partner and it's something that you're interested in doing, we would ask that you email our COVID-19 mailbox and just provide your name and your contact information, what agency you represent, and we would be happy to get back to you, or you could make a phone call to that phone number that's listed. Okay, I'd like to open it up, Annette, if you could just see if any of you guys have any questions or comments, I'm happy to, we got a little bit of time left, right? I'm happy to answer any other questions or comments.
I don't see any new questions in the chat, Jim.
Okay. How about, is anybody that's on the call, are they going to be participating, do you know, on the 3rd, the 10th, or the 17th?
We do have some MRC volunteers that are willing to participate.
Okay. Kiddo. So I would like to say thank you, and I know Annette's going to as well, but I just want to thank you guys for all of the work that you do and for participating in this training. I hope it was helpful to you. If you weren't familiar what closed pods are and how we operate them and why they're so really vitally important. Not a week goes by that the state doesn't want to know how we're making out with our closed pod partners, and the work that we're doing around them. And I'm just really grateful that the communities are stepping up, and the EMS agencies and all of the schools and the hospitals that are really doing a lot of work as we get ready for this COVID vaccination effort that we know is coming. So thank you for spending your time with me tonight and putting up with me. And I really appreciate it. So, Annette?
So, yep, there are 2 questions now. So
Okay.
one is, can you just go back to the one slide that you were at before this one that has the email address, which is covid19@nchcnh.org. And then the other question is just about describing the open pods, a little bit more of a description about open pods.
Sure. So April just pointed out that I put the wrong email. It's NCHC, not the way I wrote it there. So I missed that.
Oh, I'm glad that you said that. Thank you. And it looks like Anna put it in the chat as well.
All right. Did you just want to say it one more time what it's supposed to be?
Yes, it is covid19@nchcnh.org.
Thanks.
And
Okay. I had a sticky key. Yeah, that's right. That's my bad. I own it. And then the other one was they wanted me to talk a little bit more about the open pods.
yes.
Okay.
I'm not sure it's Susan's question about open pods as designed so far. Can you?
Sure. So the open pods, we worked with all of the schools in the region that we have open pod MOUs. So these we actually did MOUs because there's I don't mean to give anybody a headache going back so fast. A lot of things that went into these open pods than when they were developed back in around 2005 to 7. So we did do an MOU with the school superintendents for all of these different open pod sites because we really need to take over the school. So that causes some heartburn, right? And I get it. But the whole premise when we did these open pods in the entire state of New Hampshire is that school is going to be closed. There's going to be a state of emergency declared. There's going to be a public health incident declared, which there will be, and nobody's going to school. So the thought was from the state Health and Human Services folks, Homeland Security folks, was that they're going to be vacant, and that the school superintendent said, yeah, we don't mind if you go in and use pre-identified areas of our schools to do vaccinations or to do medical countermeasure dispensing. Because back in the day, remember, it was just Doxy and Cipro, right? It was anthrax. So the school said, sure, you can use them. So those MOUs have been in existence for a decade, more than a decade. Superintendents have come and gone, admittedly, but every time one goes, we get another MOU signed with a new signatory on it. So that's how we developed the open pod. And then each school provided us with a site map of the school. And we went in and figured out what rooms we needed to use for what. The auditorium, or whether it was a cafeteria, how the traffic flow was going to work and things like that, and how we were going to get 9,000 to 10,000 people at these schools within 36 hours for an anthrax event, or over a longer period of time for COVID-19, for a vaccination of anything. It didn't have to be COVID. So that's how all of the schools got to be used, because they really were recognized early on that they had the space. They're a governmental entity, right? A school administrative unit. So it was felt that they really became the best site to have become a pod, an open pod. Every open pod is managed in our region by an emergency management director who has the legitimate authority to order resources and to charge, items and things like that. So, for example, in Berlin, it's the Berlin Fire Chief who's the emergency manager. So Chief Watkins is the pod manager in Berlin. In Bethlehem and Profile, it's Chief Jack Anderson, who's also part of our unified command staff, as is Chief Watkins. So the pod managers really are the emergency managers, because they have legitimate authority to do stuff that we can't, because we're coordinators. So we go in and help out, provide technical assistance, but we don't have the authority to do anything. Is there anything else you wanted me to go over for the open pod? Susan? I'm happy to. I could talk about this all night, just a warning.
And honestly, I'm sorry, I don't mean to be asking so many questions. I'm curious.
That's okay.
The 3 food clinics that are lined up, but maybe that's a different audience. I'm not sure if this was specifically supposed to be a training about the
I didn't catch the last part, Susan, I'm sorry.
clinics that are scheduled. And I'm not sure if the audience in this meeting is relevant to that, or if this meeting was supposed to be about closed pods. And if it's about closed pods, then I'll withdraw my question about the flu clinics.
I heard something about flu clinics.
Yeah, I'm sorry. It was the same for me. Just I think the microphone, it's inaudible for us to hear, but I would be happy to read your question or your comment if you want to put it in the chat. And I was going to just add that the next steps in terms of focused on MRC, but also more broadly, when just thinking about all of the different places that you're all from. We've been working, as Jim mentioned, that we've been, as a public health network, working with the state every week on the phone with them, and they have a CDC representative, and we're being told, by them that as the vaccine is being produced and tested and getting ready, the CDC plans to send it down through the states and then through the public health networks. And they're encouraging us this year certainly to prepare, because what we saw last year was the results of COVID-19 produced so much devastation to our healthcare system and our healthcare workers that they're trying to prevent influenza-related illnesses this year, and they're encouraging us to try to increase the number of people that are vaccinated against flu, so that we can hopefully have a healthier population, and hopefully the healthcare workers won't be taking care of flu outbreaks as well as COVID-19. And so this year we're hosting, we're partnering with Lancaster, Littleton, and Haverhill to host those 3 flu clinics for adults and for students this year, and for anybody really. So we have several MRC volunteers who have agreed to participate with us, which we're very grateful for. And we thank you very much for that, and we appreciate all of you coming tonight. And if you have any questions, please let us know. We are going to be trying to process this recording so that we can share it. I know a few people have already asked about that. And I can see Susan's question now. I'm going to read it. She says she's very sorry about her microphone. She was asking for information about the upcoming flu clinic. She'll contact me via email for more information. And I think that's it, unless there are any more questions.
Awesome. Thanks so much, everyone, again, and we look forward to seeing you on the 3rd, 10th, and the 17th, if you can help out. You'll be hearing more about the closed pods as we work through going up to Gorham and Lancaster, Berlin, to talk to those agencies as well. So you'll see us around, you'll hear us talk about it. So thanks again. I hope you all have a great night and stay safe.
Thank you.
Thanks.